All right, joining us live as he does this time almost every week is Dr. Isaac Bogosh, infectious diseases specialist at Toronto General Hospital. Dr. Bogosh, always good to see you and appreciate the time here. Let's start this week taking a look at flu activity in Canada, which appears to be picking up. This, of course, is all happening as a lot of people are getting together for family gatherings. So what's happening here? Are flu shot numbers lagging? Do more people need to roll up their sleeves? What are you seeing or thinking about this?
Yeah, it's certainly, as we say, 'tis the season. We're well into December, and to no one's surprise, we're starting to see a rise in flu activity. There's decent surveillance for this across the country. The percentage of tests that are positive for flu is starting to rise. Similarly, the percentage of tests that are positive for RSV is also starting to rise. Hey, you know what? We've got vaccines for these. There was always a very large influenza vaccine program and rollout in the fall. It's available at most pharmacies across the country. The influenza vaccine is also available at public health clinics and family physicians clinics as well. And it's a great idea to get one. Anyone 6 months of age and up can get one. Of course, nothing in life is perfect, but it does a really good job in reducing the risk of infection. And if you do get an infection, it does a really good job in mitigating the severity of infection. And it's a wonderful tool to have in the toolkit. And obviously every year the vaccine rates do lag. There's always room for improvement on this front, but it's not too late to get one if you haven't had one yet. We're going to start to see a lot more flu activity in the coming weeks.
I suppose that's the key message, that it's not too late for a lot of people who still haven't done it. Okay, I also saw, Dr. Bogosh, that you tweeted too about flu cases in the province expected to increase, certainly as you just alluded to, not really surprising this time of year. But from what you're seeing and hearing on the front lines, are hospitals, from your position, prepared for the reality that likely more people are going to be admitted?
Oh, absolutely. Absolutely. I mean, this is something that's played out long before COVID-19. We always know that December and January are going to be busy months. And, your healthcare teams across the province and across the country roll up their sleeves and get to work. And yeah, of course, it's busier. And of course, the hospitals are, there's usually more people around. But you know what? We're here for you. And of course, it's not just hospitals. There's pharmacists, there's outpatient care, family physicians' offices. And, we always hear about how we always hear about how stretched our healthcare system is. But, there's a massive cohort of dedicated people that are truly here to help Canadians when they get ill. And we know that there's sadly going to be more people coming in over the winter months as we have circulating flu, circulating COVID, circulating RSV. We obviously have many tools to prevent and reduce the risk of infection. But if people get sick for any reason, we're here for you.
Okay, that is certainly reassuring indeed. And yeah, it was during the pandemic when we couldn't believe what was happening. And you talk about stretched, it was overstretched clearly. In the meantime, though, let's talk about walking pneumonia. We've had that conversation with you a few times the last couple of months. The rates right now appear kind of high, especially among kids, about 5 to 17 years old. You also tweeted something about a suggestion of resistance to macrolide antibiotics. So first of all, what does that mean? And how much of a concern is the resistance and those numbers?
Yeah, thanks for bringing that up. Yeah, so walking pneumonia, it's a bacterial infection. The bacteria is called Mycoplasma pneumoniae. We know that it can impact anyone from any age, but it does have a more significant impact on younger cohorts. It's called walking pneumonia, as the moniker implies. People can get pneumonia. They might not be sick enough to be flattened in a hospital, but make no mistake, it sure can cause severe illness. Just many people are walking around feeling crummy with this. There's lots of different antibiotics to treat this. There's many, many different types of antibiotics that will work very, very well. There's a category of antibiotics called macrolides, of which there's many different antibiotics underneath that category. And, the surveillance in the province shows that about 15 to 16% of these bacteria will be resistant to macrolides. It doesn't mean you shouldn't use them. It just means that if someone's using a macrolide antibiotic and they're not getting better, you can switch to another one of the many other options we have to treat this infection. But yeah, make no mistake, this is not a hard infection to diagnose. This is not a hard infection to treat. We have lots of antibiotic options that are readily available, safe, and very effective.
Okay, well, that is also reassuring as well. Dr. Bogosh, always appreciate the time. Thanks so much. Have a great week. We'll see you back here this time next week.